Hi, everyone. Welcome to the Brush with Britt podcast. This episode is extra special because we're not only wrapping up Dental Hygiene Month, but we're also celebrating the 100th episode. I honestly can't even believe we made it here because over the years, I've had the chance to meet and connect with so many incredible dental hygienists who have inspired me, supported me, and helped to shape my journey in this profession. For this episode, I wanted to highlight just a few of the hygienists who have made an impact on me personally. I asked each of them to introduce themselves, share some of their most favorite things about being a hygienist, and to leave us with a little bit of advice and encouragement in our roles. And let me just say, there are so many more people I could have included. This episode could have been hours long if I try to fit everybody in. So if you don't hear your name or your voice in this one, please know you are still very much a part of this celebration. This episode is really about honoring all of the amazing hygienists who make this profession what it is. The heart, the passion, the purpose, and the community behind it all. So cheers to 100 episodes and to Dental Hygiene Month and to every single one of you who keeps prevention at the heart of what we do.
My name is Dr. Joy Voigt Holmes, and I am a dental hygienist with a doctorate degree. I love to lead with that because dental hygienists are awesome. I have been in the field of dentistry since I was 16 years old, and I'm going to age myself a little bit. I'm practicing as a clinical dental hygienist for almost 30 years. In terms of what I do in dental hygiene, I've held many roles. I've been an educator. I've worked in public health. I've worked on the corporate level. But right now I'm active in my Dr. Joy RDH brand and actually started teaching clinically again, just in the evenings because I love teaching. I love students and I love being in the clinic. With my Dr. Joy RDH brand, I am really focused on elevating the hygienist, creating that master clinician. And in addition to that, I co-own a business called Gel Ed with 3 other wonderful dental hygienists. And that is a company designed to bridge the gap between education and an educator because we need more dental hygiene educators. To me, being a dental hygienist, I see it as a sacred service. It is where science meets the soul because I am a science person. I think you have to be a science person to be a dental hygienist. It means holding space for people's fears, restoring confidence one smile at a time, and really reminding each person of their worth. It's important to know, and I tell people this all the time, I don't just clean teeth. I care for people. I care for stories. I nurture health. I empower and I transform. And all of this work is done in love in action, and every smile is a blessing that we can create together. One of my favorite things about being a dental hygienist is I can be a boss. I can create my own lane. I can just do whatever I want to do. And that is the beautiful thing about dental hygiene. I can walk in my purpose and change lives at the same time. My words of encouragement would be to stay the course. If you are truly in it for the passion and you're truly walking in your purpose, understanding that times are going to be hard, that sometimes you may feel broken, but you're not broken. And I would just say be authentic, be authentically who you are. I don't want you to be like Dr. Joy. I want you to be your best self and create your own version of what it means to be a dental hygienist.
My name is Amanda Hill, and I'm a dental hygienist. I've been a hygienist now since the 1900s, as Britt so politely asked me one time, which I love. No, I love it so much because now I use it because it's so funny. So next year is 30 years in dental hygiene. I've gotten to wear a lot of different hats within dental hygiene. So it hasn't just always been clinical. It's been like at points it was full-time and at points it was like part-time and at points it was a couple days a month, like depending on what my kids needed, what my family needed. And I love the flexibility for that. And then I've been able to branch out into speaking and into research and into writing and into working as a consultant with companies, which has been really exciting that there's an entire world outside of clinical hygiene. I think lots of times as hygienists, we box ourselves in and we think, well, I only know how to clean teeth. And I want to encourage everyone listening everybody, like whether you're still in school or whether you've been doing this for 30 years, you know way more than you think you do. And you have so much knowledgeable information that companies need, that the public needs, that our patients need. And so don't be afraid don't belittle yourself, like don't put yourself in a box, but really embrace all of this awesome knowledge that you do have and keep learning, keep being curious about learning new things. And I think that's what's allowed me to wear so many hats, is just being insanely curious. I adore, first off, the flexibility. For a while, my husband was deployed in Iraq and life was crazy. And I had 3 kids and they're under the age of 10. And so I worked 2 days a month, right? Like what job can you do that and still make pretty decent money, right? Then I love where it's taken me. I love the impact that I can have on the public. Like whether they're my patients or whether it's my neighbor next door who just got diagnosed with throat cancer. And I was like, all right, let's talk about dry mouth and let's get some products in. And I don't know that her dental hygienist is going to be a good, curious, excited hygienist that really is looking out for my, this person, my neighbors, longevity and wellness. And I know that I can. And so I can do that whether it's I can do that whether it's in my neighborhood. I can do that whether it's in the aisle at the drugstore. But I can influence and impact people's health. And that means so much to me. Keep learning. Like, do not stop learning. I know you're like, dude, I'm in school and I'm so tired and I know the things and I learned the things. And if I still was doing hygiene like I learned back in the 1900s, like I wouldn't be serving patients well, right? So keep learning, get curious about products that are out there, take classes, like take lunch and learns, take webinars, whether they offer CE or don't offer CE, but also use your judgment. Like don't just fall for marketing, spend some time looking at research and understanding products, trying products, bring stuff into your op and talk to your patients. Patients love it when you're like, oh my gosh, okay, I've got this new thing. And I think it's going to work for you, but let's try it together. Let's team up together. And when you're in collaboration like that with your patient, you are building that bond of trust and you're really taking your seat at the healthcare table, which is so important that we recognize as hygienists. We are healthcare professionals. We're not just teeth cleaners. We are there to affect people's whole body health, head to toe. Embrace that and embrace curiosity.
My name is Shelly Brown. I actually became a dental assistant in 2001 and then a dental hygienist in 2008. And then I worked private practice and actually started teaching at my alma mater in 2009. And then in about 2014, I started a dental education company where we made a lot of helpful videos for the world on dental hygiene tips and tricks and products and all the things. And then in 2021, I started a mobile dental hygiene program here in Utah where I could see patients in public health settings. So I get to go about autonomously preventing oral diseases, which is super fun. And then 2025, just this year, started a company to help educators improve their skills in the classroom. So that's a little bit about me. So to me, to be a dental hygienist, there's like mainly 4, I would say, diseases that we prevent. We've got caries, we've got periodontal diseases, we've got oral cancers, and we have occlusal diseases as well. And so I think as a dental hygienist, we have to recognize that we're not just scraping teeth. I thought literally when I went to school, I was like, sweet, I get to like scrape teeth in a little tiny corner my whole rest of my life. And I didn't realize how much bigger dental hygiene actually is. And so I think with all of that, those things that we do, those 4 diseases that we help control, that we really have an impact on overall systemic health as well. We're not just, working only in the mouth. What happens in the mouth does not stay in the mouth. It travels throughout the body and can wreak havoc on other systems. And then also advocating. So helping advocate for our patients to have better, oral health overall, helping advocate to policymakers and stakeholders to help them understand that oral health is overall health. At the same time, we need a seat at the table, right? I would say that my most favorite thing is a term called minimally invasive dentistry. I'm all about it and I'm all encompassed in it, especially when it comes, to caries. But Obviously, when it comes to caries, we just have more and more remineralization options to us nowadays that help us prevent caries altogether. We don't have to amputate the tooth anymore, the tooth structure. That's going to become a way of the past, and we're going to be shifting towards more focused on preventing decay before it starts. Obviously, there's still going to be options for repair and need for repair, but hopefully we can preserve more natural tooth structure. And the same goes for periodontal diseases. We have little tiny cameras that go underneath the gingiva and help us see the root surface so that we can actually see what we're doing and we're not just like guessing what we're doing. So we have a lot of new ways to prevent. Hopefully we're always striving to find better ways to make impacts on our patients' lives and on their overall health and the patients that we serve. I used to go to CEs thinking I just had to do these types of things, but maybe go with them with an open mind saying, how can I like really improve my patient's oral health? And that also helps us not get burnt out or bored, right? Because we hear that term a lot lately, and we don't want to be there. And so I do think that as we are trying to innovate and improve patient care, we can have a huge reach if we stay in the know of what's going on. Go around the room when you're at one of those conferences and say, what's new? Show me the tips and tricks and techniques, because I just didn't realize that I could ask what questions to ask, or that I could ask that and do something different. I was like, I have to do what I was taught to do, but there's so many exciting new options out there for us and for our patients.
Hello, everyone. My name's Derek Sven. I am a clinical dental hygienist of 10 years. I have a previous background as a dental laboratory technician with a specialty in crown and bridge. I have gone on to pursue more academic achievements than might be necessary. I have a master's in business administration, a master's in public health. I'm pursuing a third master's in healthcare law and a doctorate in health sciences with a focus in policy and advocacy work. I am currently president of Virginia's Dental Hygienists Association, and I am an active leader in the Advocacy Advisory Committee at ADHA. I really, really am passionate about moving our profession forward. Two words really hit home for me on what a dental hygienist is and what I view myself as to my patients. One, an advocate. Early on in my career, I was working in the administrative side of dentistry as opposed to just doing clinical work. And a patient came in and a treatment coordinator had abruptly dismissed the patient as not being suitable for the practice. The patient walked past my desk and I noticed a lump along his lymph node chain. I asked him if he would mind if I put a glove on quickly and just check it. It was hard and immovable. So I went back and asked the dentist, I said, look, I know we're not seeing this patient, but do you mind if we just give him a referral to oral surgery so they can assess him and see if there's anything going on? Dentist said yes, he wrote the referral. We sent a patient off. About a day later, the patient called and said the oral surgeon wouldn't see him because it wasn't within the head and neck zone they're accustomed to treating. So advocated for the patient. We got him a referral to the local university. About a week later, I got a phone call from the patient again. He was at the university being given a runaround. He said, if you really, really think that this is concerning, he said, I will go to a private clinic and pay out of pocket to have this looked at. And I said, yes. I said, something hard and immovable along the lymph node chain is not something we can just, say is fine to just monitor. We need to have that looked at. It was stage 4 cancer. Even the private doctor who saw him that day thought it was not something that significant, but he went ahead and did the biopsy out of an abundance of caution. A year later, I got a phone call from the front desk and I picked up the phone and he said, Derek, do you remember me? And I said, oh yeah. I said, what happened? He goes, I want you to know you saved my life. It was the single most surreal experience I've ever had, having somebody tell you that. And realizing how powerful what we do is. The simple act of assessing a patient for oral cancer, looking along their lymph node chains, giving them those referrals, acting as their advocate can save people's lives. We do not need to be doctors. We do not need to be oncologists to do this. This is something every hygienist can do and own. Be an advocate for your patients. The second thing that hygienists are, I view myself as, we are prevention specialists. What we do, everything we do, is to prevent the public from needing a dentist. We have the ability to heal and reverse disease in a way that other practitioners in dentistry don't have. We're not dental therapists. We don't drill on teeth. We're not dentists. We're not surgeons. We don't want to be. We are there to reverse disease before it actually needs intervention. And with the modern tools that we have today with Curadont, with SDF, with all the amazing technologies that have come out, there is no excuse for hygienists to not be excited and empowered with their ability to be the prevention specialists and advocates for the public we can be. That is the unique power hygienists have. We are the one professional in the country that, by far and large, patients come to twice a year for assessments. We have that ability. We have to own that. We have to see ourselves that way, and we have to present ourselves to the public in that capacity, because that's what we're doing and that's what we're capable of.
Hi, I'm Anchi. I also go by Angela, and I'm a pediatric dental hygienist. I've been in pediatrics for over 20 years now, both as an assistant and a dental hygienist. And honestly, I can't imagine doing anything else. Every day I get to work with kids and families and help them take care of something that's so important, something that will literally last a lifetime. To me, being a dental hygienist is much more than just cleaning teeth. It's about being an advocate for my patient, a teacher for my patient, and maybe even guiding the parents, and sometimes even being a cheerleader. Especially in pediatrics, kids can be nervous or unsure about what's going on at the dentist, but being able to make them feel safe, comfortable, and confident, that's honestly the heart of what I do. It's about creating trust, educating families, and making a real impact on their health, one child at a time. My two favorite things about being a hygienist: first, I love the connections I get to make. Every child is different. Every family is different, and learning how to meet them where they are is a rewarding challenge. Seeing a child go from being nervous or hesitant to proud and excited about their oral health, that's why I do this work. Secondly, I love making a difference in prevention, catching problems early, teaching them healthy habits, and helping families feel empowered to care for their teeth. It's just an amazing feeling to know that what I do today can prevent any pain, missed school days, cavities, or even bigger dental issues down the road. So these little victories, like a child showing how well they brushed at home, are what keeps me motivated every single day. For anyone who's thinking about this career or just starting out, here's my advice. Stay curious, be patient, and remember why you started. Remember your why. Know that every patient you see is an opportunity to teach, to comfort, and to make a real difference. Don't get just caught up in the clinical side. The relationships you build are just as important as the procedures that you do. Also, take care of yourself along the way. This job can be physically and emotionally demanding, so even though it's one of the most rewarding careers you can choose. But lean on to your friends, lean on to your colleagues. Keep learning and celebrate the little wins that you have, because those really do add up. Being a dental hygienist, especially in pediatrics, isn't always easy, but it's always meaningful.
Hi, everyone. My name is Sue Scherer. I am a registered dental hygienist. I have been a clinical hygienist for over 23 years. I have had the privilege of doing so many amazing things beyond clinical hygiene. In addition to clinical hygiene, I have authored for RDH Magazine, Compendium. I've written a whole bunch of continuing education courses and been so fortunate to deliver those across the United States and in Canada. Lots of webinars as well. I have worked in the local community college where I went to dental hygiene school, and I am back working with the students again. I absolutely love that. And I have just had the privilege of getting to know dental hygienists all across the United States, and it is really an amazing thing to be a part of. Having the privilege to be a dental hygienist it encompasses all the things that I've ever worked towards of wanting to help people to improve themselves. So I just think that we are healthcare providers who have this amazing opportunity to not just get people in and get people out, but we have this opportunity to sit and spend time and get to know people year after year. 18 years in one office, I got to watch my patients grow and age and go through things like getting engaged and getting married and having children. And all of that encompasses what we do in getting to know people to help them to be the best that they can possibly be, starting with their mouth. I love the versatility of this profession. It's pretty amazing. One of the things that I had done for about 4 years was work for a dental corporation that manufactures an oral care product. And some transitions took place, and I was able to step right back into clinical hygiene. How amazing is that? Our dental hygiene license is something that we can carry our entire career. I once heard someone say, once a hygienist, always a hygienist, and that's so true. So while we may choose to explore things that are beyond clinical hygiene, we always have these skills that are ingrained in us, and being able to pick up an ultrasonic scaler or a universal instrument and get in and care for our patients, those are skills that can never be taken away from us. And I just absolutely love that about our profession.
My name is Jessica Atkinson. I am a dental hygienist. I'm not only a dental hygienist, but I'm also a dental hygiene educator, and I have a bachelor's of science in dental hygiene. In my day-to-day, I am a dental hygiene educator at Utah Tech University in St. George, Utah. I also co-founded Hygiene Edge, which educates the globe about dental hygiene, all things dental hygiene. And then my particular favorite is I am a co-founder of Hygiene Educators and CEO, which focuses on dental hygiene educators and getting them quality and inexpensive continuing education. And beyond that, I have a master's degree in education. I find myself really enjoying educating the future of our profession. We don't just clean teeth. In fact, we are the front row, the front line, the ability to really get our patients connected with the kind of healthcare that will truly make a difference in their lives. Also, one of my absolute favorite things about dental hygiene is you always leave people better than you find them. And I love that. Top two favorite things, I would say people. I would say my connections with patients. And then I really, really enjoy instrumentation. I enjoy the art and science of instrumentation. I love the ability that we have as dental hygienists to make an impact on systemic health by removing biofilm and calculus, and that there's an art to it. And I really love that meticulous piece. I would like to leave them with the fact that you came to this profession because you wanted to help people, and you are doing that every day. And if you feel stuck or in a rut, take a look at where you have disconnected from that motivation of actually really at the ground roots leaving people better than you found them.
Hola, I'm Amber Lovatos. I go by the Latina RDH. I'm a public health dental hygienist. I've been practicing for 12 years. I am an award-winning dental hygienist. I was featured in Time Magazine at Times 101 in 2023. I've been a Sunstar Award of Distinction recipient, Dimensions Dental Hygiene, one of the hygienists that you need to know from my work in public health dentistry. I am an author. I have a self-published book called Smiles Vida. It's a dental children's Spanglish book. But this month, exclusive news, I have 2 dental Spanish books coming out. One with Elsevier, which is a general dental Spanish for the dental team book, and then a dental hygiene, dental Spanish workbook. I'm on Instagram as the Latina RDH, and TikTok. On Instagram, I have 50,000 followers, and I teach basic dental Spanish, and I talk about my work in public health dentistry. I'm also part of the ADHA. I'm one of the leaders, been past president of my component. For me and my organization, I bring scholarships every year, especially for Hispanic and Latino students. This year, we raised $3,000 for DACA dental and dental hygiene students. So my work is to bring representation to the community, support my community, but also to help you provide better care for people who are Spanish speakers. To me, what it means to be a dental hygienist means that we get to serve. I think that we have powers in our hands to heal. And that might sound like really corny, but I've had patients tell me like, oh, you really like your job. And I'm like, yeah, I really do like my job. I have this skill set that helps people get healthier. And I think there's just so much power in that. One of my favorite things about being a dental hygienist is all the opportunities that I've gotten. Really, I think this profession is what you make of it. Some people may be unhappy in this profession, but I've loved it. I've been able to travel all over the U.S. I've worked with companies like Crescent ROB in doing community outreach work literally all over the U.S. I've gotten to make great friends like Britt, meeting people through social media. There is so much opportunity in this profession, but it's what you make of it. And for me, that's been like the best thing. And not only am I a clinical dental hygienist who makes an impact in people's lives who are low income and uninsured, but I also get to make an impact in other people's lives. And I think that's amazing. I have 2 life mottos, me vale, which is I don't care. That means that I don't care what somebody else is saying about me, but also I don't care what negative Amber is thinking. Okay. I don't care about those negative thoughts. I'm going to do the things anyways. And then dale, which means let's go. Behind the me vale, the I want to be a speaker, I want to be a content creator, a public health hygienist, behind wanting to do that and doing that, you have to put some work in. So dale, let's go and do that work. But don't let those negativity or comparison deter you from reaching that goal.
My name is Dr. Emily Bogey, and I've been practicing dental hygiene for over 20 years. I began my career chairside, much like a lot of us. And then over the years, my role in hygiene has evolved. And so I was a program director for both a dental assisting program and a hygiene program for about 10 years. I did some advocacy for the ADHA. Product development. I have a few dental instruments that I've designed and brought to market. And then, the whole time I've always stayed really rooted in patient care. Like no matter where the path brought me, it always came back to caring for the public, caring for other hygienists, caring for our patients. And it's just really exciting that what originally drew me to hygiene is what's keeping me in hygiene. And I'm able to elevate others who are also in a profession who want to do all kinds of fun things. Being a hygienist means that you are a change agent and you're always trying to help your patients grow and you're trying to help your fellow professionals grow. And I'm a true believer that if you aren't changing and you aren't evolving and if you stay stagnant, that's when you tend to burn out on things. It's about connection and prevention and empowerment all bundled up together. Although I'm in the corporate sector, technically, I'm still able to hang out with hygienists and get inspired by hygienists and then really serve as someone who can uplift and lead others and serve other people. And I still get to live my own mission, which is, having empathy and integrity and purpose for the profession itself. I think my favorite thing about being a hygienist is watching people transform, whether it's a patient who has just never understood home care and they've never understood why we preach and preach and preach to them, or if it's a student who finally understands something in clinic or in the classroom and their eyes just light up and all of a sudden they have all this confidence. It's helping people find their voice, whether that's their voice as a patient, voice as a student, faculty, as I was helping faculty evolve and learn methodology and stuff, because people don't go to school to be a dental hygiene educator always. A lot of the educators we see come out of clinical setting and they don't always know how to teach. And so I went through a good portion of my life and I'm still helping people discover how to teach others. And so every single day we get to learn, because when you teach, you learn, whether you want to or not. You're always learning something. And I shouldn't say whether you want to, but whether it's intentional or not. And regardless of the role we play in the dental community, these moments of personal growth and gratitude and relationships, like the relationship we've built over the years, it just inspires me and empowers me to be a better dental hygienist, because if we're going to make the world better, we got to start, one person at a time. And you don't know what you don't know. And so if you feel like you're stuck, the best solution is to go out and learn something new. And then once you know better, you can do better. And so time and time again in my career, I have sought out education as a way to find what I was looking for. And sometimes I had no idea what I was looking for. And that's okay too. Like you don't always have to have the answer, but when you feel like maybe you're stuck in a rut, my own personal experience has showed me education is always the answer. Whether that's, taking a knitting class, or maybe you take a cooking class, or maybe you take a new exercise class or something. It doesn't have to be dental hygiene related when you reach out of your comfort zone. And I think that that's where I have really pushed myself, and I see others really benefit just getting a new insight or a new education.
I'm Susan Cotton. I am a registered dental hygienist, and I've been a dental hygienist for 31 years. I've worked in both public health and private practice. With the last 15 years, have had an extreme sliver of focus on oral cancer and HPV. And I started my business in 2018, Oral Cancer Consulting. And currently I'm a speaker, author, and trainer. I speak at dental and dental hygiene conventions on HPV, oropharyngeal cancer, and I hold hands-on screening workshops for dentists and hygienists. It's a privilege and an honor to get to serve the public. They trust us, they come in to see us, and to help them better their lives through improved or maintained oral health, but really to get to save lives by performing that comprehensive screening, every patient, every time. Most favorite thing is all of the people I've met, the community that is dentistry, that is dental hygiene. I've found my tribe, my friends, my true friends. And right now, that's my favorite thing. Keep learning, keep growing. That's what makes this profession so exciting and fun, is that dentistry's changing all of the time. And what we get to do as dental hygienists is increasing and changing all the time. So don't stay stuck, keep learning, go to conferences, and then bring it back and serve your patients well.
Hi, I'm Whitney, and I've been a hygienist for 10 years now. It's my 10th year. So excited. I've worked clinically this whole time. The first 5 years I was full-time, and these last 5 years I've been part-time, which has allowed me to dedicate more of my time to making YouTube videos. I love making YouTube videos, dental health awareness on YouTube. My YouTube channel is youtube.com/teethtalk. In addition, I'm also a writer. I have teethtalkgirl.com. I've written hundreds of articles there. I've also written I've written for some other magazines and things like that. And I've also dabbled into speaking this year. So I used to only do motivational speaking, kind of telling my story about YouTube, but now I also speak on an actual dental topic. So I speak on dental health misinformation on social media. I talk about effective communication techniques with your patients one-on-one in the op, as well as how to kind of combat misinformation online. I'm currently pursuing my doctorate in health science. I'm at Old Dominion University, which has integrated with Eastern Virginia Medical School. To me, being a dental hygienist means being part of someone's health journey, right? Honestly, I think it's a privilege to help patients overcome fear. That's a big one. Understand their oral health and truly just feel proud of their smile, right? For me, it's about creating positive experiences in the dental op, right? That can change how someone views dental care for life. I love helping people understand why oral health matters, right? Getting to educate, encourage, and sometimes, even comfort people who might be nervous about being in the dental office setting. I love turning a stressful visit into a positive experience and helping someone leave feeling proud of how far they've come with their oral health.
My name is Shelby. I am a registered dental hygienist of 3 years. I did 1 year in general, and I'm currently working in periodontics. Before being a dental hygienist, I worked 9 years as a registered dental assistant, and my background was in oral surgery. I really pride myself in oral hygiene education, and a lot of the videos that I make are to help other providers be able to communicate effectively with their patients so we can motivate our patients to make better oral hygiene decisions. To be a dental hygienist means that we are our patient's preventative health professional. This role is to promote great health, prevent disease, empower people to take control of their oral health as well as their overall wellness. We're addressing a lot more than just what we see clinically. We are not only looking at inflammation, but we're looking at systemic health factors. We're looking at behavioral changes. We're looking at social determinants of health that influence the patient's ability to take care of their mouth. While we do treat a lot of disease, our real and our best work is rooted in health promotion, guiding patients through that process, helping them understand how to take care of their oral health, make those sustainable changes, and why we're making those changes. So in essence, I just think being a hygienist is all about prevention, using our clinical skills, our education, our communication with our patients to help them understand why oral health matters. The thing that I love the most about being a dental hygienist is when you gain the patient's trust. Because when you gain the patient's trust, I feel like that's when the real behavioral changes start. When the patients feel supported and understood, I feel like that's when they begin to apply what we teach. Building the patient's trust and building that rapport with the patient are two of what keeps me going as a dental hygienist, keeps me motivated, and keeps me passionate about the field.
Everybody, I'm Aniston, also known as Fosbury Aniston. I just graduated dental hygiene school. I was class president. I wrote some articles for RDH magazine. I create content for dental hygiene students and others to educate them about oral hygiene. To me, being a dental hygienist means that you are a primary care provider, that someone is a vital role in your life that you go to, that they're able to identify early signs of oral cancer or other suspicious lesions, and you're able to connect with patients the care that they need before it progresses. So we are educators, advocates, and preventative care specialists who help people live healthier lives beyond just their smiles. My favorite thing about being a dental hygienist, what I've learned so far, is that you can change the world. Us hygienists can change the world one smile at a time. So if you're able to help somebody, you can change their world. And we're able to be there to help guide them and help them with their health and their confidence.